Here's 6 heart block rhythms that you need to know. If you don't know these, you're gonna have trouble on your exams. The first 4 are blocks between the SA node and the AV node, and the next 2 are blocks after the AV node. So if we look at sinus rhythm, there's a QRS after every single P wave, and the rate is regular. In first degree heart block, we have to look at the PR interval, which is here from the P wave to the R wave. In first degree, the PR interval is greater than 5 small squares, and the rate is regular. You can see the same things happening on every beat. Second degree heart block type 1 is different because at every P wave, the PR interval increases. So here we can see it's short, it's medium, now it's pretty large, and then this one, it's got so big that a QRS complex has been completely missed. And if we count it, we've got 1, 2, 3, 4 P waves and 1, 2, 3 QRSs, so that means it's a 4 to 3 heart block. In second degree heart block type 2, the PR interval that we were talking about earlier stays the same, but the difference here is that some impulses just don't get through full stop. So if we look at the pattern that's occurring, we've got 1, 2, 3 P waves and just 1 QRS, which means this is a 3 to 1 heart block. Third degree heart block is also known as complete heart block because unlike this one where some impulses don't get through and this one where impulses delay until they don't get through, this one just no impulses get through the AV node. And this means that the heart, the ventricles, have to generate their own QRSs, and it has its own rate that it does that, completely independent of the P waves. So in this kind of rhythm, we'll see normal P waves, see they line up with earlier on, but the QRSs will just occur randomly, so the PR intervals will be totally random. We've got a big PR interval here, then we've got nothing here. The last 2, left bundle branch block and right bundle branch block. So this is where there's a block along the left ventricle, and this is where there's a block along the right ventricle. This means that there will be an impulse that goes down the right side of the heart first, and then goes down the left side of the heart. So you'll get a little bump on the ECG. That's what we see here, see a little bump. And for these we want to look at V1 and V6. And then in right bundle branch block, we have the impulse travelling down the left side first and then going into the right side. So an easy way to remember this is the mnemonic William Marrow. William is used for the left bundle branch block because it's got an L in it, 2 L's, and Marrow is used for the right bundle branch block because it's got R's. If this video helped you, please give me a like and a follow. And as a bonus, which one of these rhythms do you think is the most dangerous? Hint, it's near the bottom.